This morning, I guess our time, we got here around 4 a.m. And then I think we already have our alarm set for 2:15 in the morning tomorrow to fly back, and we have more work to do there. But we are thrilled to be here again. I love to teach, and this is where I get the most excitement, when I get to, give you new tools. We're here to give you tools that you can take, that you can use to defend God's preborn and just enlighten you. This is a ministry that Leslie and I have been involved with since 1999 when we started it. And she'll be out in the front area. She is much smarter than me. So you can go out, and she has lots of stuff and information for you. But we also wanted to not only thank you for taking the time to come here tonight. You had a lot of other options on what you could have done tonight, yet you chose to be here tonight. And that says a lot about your character and your desire to do the right thing. But we also want to congratulate you, because you didn't know it, but Karen pulled your transcripts. She pulled all of your grades, and we reviewed them. And congratulations, because you have all been accepted for tonight to the School of Medicine. All right, so I'm going to take you into the OR. I'm going to take you into labor and delivery, and we're going to teach you how we treat the preborn as patients and what it means to be a physician. When I started medical school, the first thing that they teach all medical students is this: a little bit of Latin. How many of you are fluent in Latin? All right, not many. All right, well, it's all right. It's all right. Wiki, wiki, wiki? Well, there you go. Gum, gum, dum, dum. But we're going to learn a little bit of Latin tonight. And don't worry, it's okay if you don't know Latin, because 99% of Latin America doesn't know Latin either. So it's okay. But we're going to give you a few phrases, because that's what they teach us in medical school, because so many of the medical terms are based on Latin and even based on Greek. So we're going to focus on Latin. So we're going to learn a few words tonight together. Well, the first thing we're going to teach you is primum. And I want you to repeat that after me. Primum. No. We're talking Latin here. This is a Romance language here. This is like Italian and French. You got to do primum. You got to get the hand into it. You want to make an Italian quiet, make them sit on their hands. They can't communicate. So here we go. Primum. Primum. All right. What's the next word we're going to learn? Non. Non. Next word, nocere. So I want you to look at the person that you came here with, and I want you to look him in the eyes, and with the Latin Romance, I want you to look him in the eyes and go, primum non nocere. All right. So what did you just say to your partner? You probably should have said, what am I saying, before I look him in the eyes and say this. What you said was, first, do no harm. When you start in medical school, you're going to have exposure to amazing tools. They're going to give you scalpels. They're going to give you needles. They're going to give you chemotherapy, radiation, antibiotics, robots. There is nothing but tools and fun things to do there. But even though you're going to be using these tools, it's real important that you do no harm. And that's the first thing that we all learn in medical school. Primum non nocere. Well, what's the next thing that we learned? Number 2 is that patients have rights. Who here has never been a patient before? All right. Nobody? All right. So we're going to assume that everybody here has at one time in their life been a patient. Absolutely. You have rights as a patient. When you go into a hospital, it's a scary place. But it's nice to know that patients have rights. And our rights come from God. It is the duty of good government to defend those rights, which come from God. This is the state of New York's Patients' Bill of Rights. They actually list 22 different rights that all patients have. And when you look at a few of them, you cannot be discriminated. If you are a patient, you cannot be discriminated on your race, color, religion, sex, age. They're going to provide you a clean and safe environment. You can receive emergency care, even a non-smoking room. If you're a patient, these are some of the rights that they guarantee you for all patients. We were at the University of Florida College of Medicine recently, and we were discussing patients' rights. And we were reviewing with them about patients' rights, and we were explaining this concept that you teach them in medical school. It's the first thing I learned when I was in medical school. And we asked the students, so if I have a patient that is in the emergency room, that needs a blood transfusion. Do I have an obligation to provide them with a life-saving blood transfusion? And the students are like, yes. I said, what if I have a patient in my emergency room that needs laser vascular surgery? Do I have an obligation to provide them access to that? And they're like, yes. I said, well, what if I have a patient in my office that needs to have open heart surgery, or they're going to die? Do I have an obligation to provide them with this life-saving surgery? And they say, yes. I said, okay, you've said yes to all of these patients. What if these patients were not born in the United States? Do I still have a moral obligation, and do I have an obligation under the law to provide them with access to blood transfusions, laser vascular surgery, and open heart surgery, even though they weren't born in the United States? And a young man in the back stood up. He goes, Dr. Lyle, we've been taught here at the University of Florida College of Medicine that a patient is a person and is entitled to respect and bodily integrity. And yes, you need to treat that patient even if they weren't born in the United States. I said, I agree with you. I was taught the same thing when I was here in medical school. But what if that patient was not born in the United States yet? And that is the key. And I told him, I said, all of these patients were not born in the United States yet, but every one of them received the care that they needed, and they were treated with respect, and they were protected. And we're going to take you into the operating room. We're going to take you to labor and delivery. I'm going to show you some amazing tools, because a patient is a person, no matter how small. And I'm going to show you how we are treating the preborn as patients in the womb. And you're like, well, what are the cool ways that you're doing that? Well, who likes pubs? It's mostly a conservative, group. Okay, we got a couple of people that were looking for the bar, and there was nothing but a bunch of juice and water. What's a pubs? Well, we're not talking a place where you can get a Guinness, not that kind of pubs. We're talking about a peri-umbilical blood sampling. Do you know that we are now doing blood transfusions to babies in the womb? We've done this at my hospital in the womb as early as 18 weeks gestation. They can't even survive on the outside for another 6 weeks, yet we can give them blood transfusions in the womb. Well, why would you need to do a blood transfusion in the womb? Because science says that at the moment of conception, the baby is a different person than the mother. In fact, not only half the time is it a different gender, and there are how many of those? There are 2 genders. The world's gone nuts with this stuff. And God created them male and female. But that happens at the moment of conception. But here's another thing. Do you know that the mom and the baby can have different blood types? At that moment of conception, that baby is genetically unique from mom, genetically unique from dad, genetically unique from the other 7 billion on the planet. But moms and babies can have different blood types. And their blood does not mix. It gets real close. Everything the baby needs comes from the mother. Everything the baby needs to get rid of, it gives to the mother, and then she removes it. But even though they have different blood types, moms can develop antibodies. And these antibodies are against the baby's blood type. And the antibodies can cross the placenta and actually start to attack the baby's blood. And the baby's blood count goes down. If we don't do something, those babies can die. Well, if they're 36 weeks along, we just deliver those babies. But what do you do if the baby is only 18 weeks along, maybe 20 weeks along? Are we going to let them die on the inside? No. Is there a way and a technology that we can keep the antibodies from attacking the baby? Not really. So when the baby's blood count is dropping, what do? We give that baby a blood transfusion. Have you ever donated a unit of blood? At church, work, something. Most of us have. And when we use your blood, if you have O-negative blood and you donated it at a blood drive, we could use your blood to transfuse to a baby in the womb to save that baby's life. I mean, that's fulfilling the greatest commandment. When the Pharisees asked Jesus, say, like, teacher, what's the greatest commandment? Like they're going to trick Jesus. Like that's what they thought they were going to do. And what did Jesus say? Love the Lord your God with all your heart, mind, and soul, and your neighbor as yourself. If you can give a unit of your blood and save the life of the baby in the womb, is that treating that neighbor in the womb as yourself? Yeah, you're saving the life of that little baby in the womb. Well, how do you do a blood transfusion to a baby in the womb? Well, you wrap that tight thing around the baby's arm, and then you kind of slap it a couple of times, wake it up, and then you give it. It's kind of similar. In fact, what we do when we, do a blood transfusion called a PUBS is we have the donated blood, we guide a needle, and that needle is going to be guided through the wall of the uterus, through the skin of the mom, and we got it right into the umbilical vein, and we give that baby a calculated blood transfusion. So that's the umbilical vein, and that needle would just come through the skin, through the wall of the uterus. So if we can give a baby a life-saving blood transfusion, is that treating the baby as a patient in the womb? Yeah. And a patient is a person, no matter how small, and patients have rights. Sometimes we have to do this every 3, 4, 5 weeks because the mom's antibodies are still attacking the baby's blood. And so we give them a transfusion, it goes up, and the mom keeps attacking. We give them a transfusion, then it goes up, and then the mom attacks until we can get to a point where we can deliver the baby. But that's just the beginning. Anybody here have twins? All right, you have twins. Boy, girl, what are they? Two girls. Were they identical? Okay. Did they share everything perfectly in the womb? I mean, even outside. Did they, when you were raising them, did they share all their toys and all their food? Little sinners, you know? But yeah, you know, not only do sometimes siblings and twins even not share things well, that starts on the inside. And this is a condition called twin-twin transfusion syndrome, where you have this big twin over on this side. I mean, these two are identical twins. Identical twins where it was an egg from the mom and a sperm from the dad came together, and before day 13, they divided into two identical copies. But this one's selfish. This one's saying, like, all the nutrition's coming in, but they're sharing a placenta. They're sharing just this one placenta down here at the bottom, but this one's selfish. And it's going, mine, 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 mine. It's just grabbing all this nutrition. Meanwhile, it's identical twin over here, kind of getting the leftovers. It's like Tiny Tim. And it's like, please, brother, might I have a little more, you know? So what do we do? Because if the little baby dies, then the bigger baby is going to soon die, the identical twin. We send our patients down to Texas Children's Hospital in Houston. Well, what do they do that's so cool? They go in with a laser, just like Luke Skywalker with a lightsaber. They go in with a laser, and they will actually take that laser, and they will divide that placenta in two. And essentially, this is your side of the placenta, and this is your side of the placenta. Now, my goodness, you two play nice and share. Nobody has done this before. We produced this animation just recently. I always wondered, well, if you're there, you're hanging with your twin, and it's dark inside, and whether you're the greedy one or the leftover one, what's it like having a camera coming? Like, picture this as being the uterus, and there's two of us in here. What's it like to have a camera come in through the top? And there's a light, and you see this. And all of a sudden, there's this laser beam like Darth Vader coming down. So we did an animation on this, on what it would look like from the baby's perspective. And when you see this, remember, you are inside of the uterus, and this is the baby's view, and we just recently produced this. So it's dark there on the inside. Unless you're out in the sun, you might get a little bit of, you know, pinkish hue. But you see the larger baby on the left, you see the smaller baby on the right. The scope gets popped, the fetoscope gets popped there, just like coming in through the ceiling here. And the kid's like, what? Check out the light that's coming through here. What is that? And then the doctors have the view from the camera, but then there's the laser. And they're literally just cauterizing these blood vessels left and right, left and right. They're just going back and forth, and they are dividing that placenta in two. They're saying, this is your half of the placenta, this is your half of the placenta. When we send our patients down to Texas Children's Hospital and they perform this surgery, they send them back to us 10 days later. They send us back 10 days later. We follow them for the rest of the pregnancy. We might have sent them down and they were like the 99th percentile and 2nd percentile. Once they learn how to share, by the time we deliver them, they might be 70-30 by the time we deliver them. So if we can teach babies in the womb how to share while they're still on the inside of the womb and save both of their lives, is that treating them as a patient? Yeah, absolutely it's treating them as patients, but it gets cooler. Y'all remember this picture? Yeah, you want to feel old? 24 years ago is when that picture, that's Samuel Armas. He was having spina bifida corrective surgery on his spine, had a defect on his spine, and they were doing spine surgery, but he knew they were cool docs, so he kind of gave him a little high five, you know, and kind of just said, guys, do a good job, thank you very much. Is that treating him as a patient when they were treating that? Absolutely. He was a patient there. He was a patient when I met him, when I spoke at Georgia Right to Life, and that's Samuel now. And he is up, he is walking, he is doing great. And what we have seen, this was pioneered by Vanderbilt University, as we've been following these kids for years now, when we take the initiative, and there is risk, when we take the initiative and we treat them as a patient inside the womb, and now that we've followed them more than a decade, when we treat them in the womb, 10 years later, they can go upstairs faster, downstairs faster. They have better control of their bladders, better control of their bowels. We have changed the quality of life on these kids by treating them as a patient on the inside of the womb. Is that treating them as a patient and the patients have rights? Absolutely. But also, let's talk about informed consent. Informed consent is a hot issue in all the medical schools and in medicine in general. Where you don't do surgery, you always have to explain the risks, the benefits, indications, and alternatives to all patients before you do a surgery. You don't just pick a random number out of the bag and say, you get a hysterectomy today. No. I mean, you have to explain why we're doing it, and there are risks. Are there risks with doing fetal surgery? Sure, we have to discuss with the mom. There's risk of bleeding. There's risk of infection. There's risk because you're going to have a C-section and maybe even have a C-section after that. So the risk to the moms? Yeah, including anesthesia. We don't do surgery unless there's a benefit for the patient, right? What's the benefit to the mom? Any guesses? She doesn't get any benefits at all. So if we don't do surgery unless a patient has a benefit, we don't just give risk, there has to be a benefit. Who's the patient that gets all the benefit? It's the baby. By definition, with informed consent, we have said that baby is the patient that is inside the womb. It is the baby's rights that we are protecting. This was generation one. That's how we were crudely doing this procedure 24 years ago. But now we get new toys. And one of the toys, whoever had gallbladder, who's a nurse here that's been a nurse for over 30 years? Anybody? 25 years. Okay. Gallbladder surgery when you were just out of nursing school. How big was that incision? Yeah, they would pretty much cut you in two, put one side over there, and take the gallbladder out and put you back together again, and you were there. Week, maybe 10 days sometimes. Who's had gallbladder surgery in the last 5 years? Anybody? Well, I'll tell you what, with gallbladder surgery now, they don't cut you in half. They go in with the scope. You get a Band-Aid here, a Band-Aid here, a Band-Aid here, and you go home that day. And if they scheduled your surgery in the morning, you're in the Chick-fil-A line there to beat the crowds, you know? I mean, technology changes things. The surgery there was generation one. We're now doing this same procedure with a fetoscope, where we are not opening up the uterus. We are actually going in with a scope and doing these repairs. It's called laparoscopic spina bifida surgery. I won't show you the surgery. Some of y'all had beef, and some of you, we've learned around the country, some people just don't do well with surgery. I mean, you know, you think somebody's having a seizure over in the back. There's chairs all over the place. They just didn't do well. So I'm just going to take you inside, not show you the actual surgery, but I want to show you the baby on the inside. I want to show you the baby where it's not just 2 lines on a pregnancy test. It's not just a black and white image on the inside. This is a patient on the inside. This is the patient that your center is doing such a great job to explain this gift to a little one, creating the image of God at the moment of conception, but this is that baby on the inside. So that's the uterus, and the uterus is exteriorized, but instead of opening up the uterus, they're just popping a couple of scopes inside. And now I'm going to show you when you put the light on. Remember the twins? There's the light. That's the baby on the inside. That baby has spina bifida, has a defect in its spine, and that's what they're going to be operating on. They take the, you're like, well, I thought there was fluid around there. Now, if you're using cautery, electricity, you don't want to have a lot of fluid. Like, you don't blow dry your hair in the shower to save time. So they drain out the majority of the fluid, and they're going to be treating this baby on the inside and repairing this defect in the baby's spine. That's Gen 1, that's Gen 2. So if we have Gen 1, Gen 2, what do you think we have next? Gen 3, y'all are sharp. Gen 3 is now using stem cells, and they're doing this out at UC Davis. What's a stem cell? A stem cell is what's called a totipotential cell. This is a cell that can become anything. And it's kind of like a 5-year-old. You look at a 5-year-old, they're real cute. What are they going to be when they grow up? They're going to be whatever they want to be, but we've got to give them some guidance and direction. That's what a stem cell is. So when they use stem cells, and we all say, well, stem cells are bad. They started by trying stem cells that were harvested from aborted babies. Guess what? It didn't work. God says, y'all, you're not going to be able to do that. So then they started to use stem cells which were harvested from placentas after a baby was already born. It worked. So what they do is they'll have the baby that's been diagnosed with spina bifida. They want to put the stem cells right there on the spinal defect. They take these harvested stem cells, they put it on a little patch, a Gore-Tex patch. They then go in with the fetoscope and they apply that patch to the baby's spine where it's not normal. And what do the stem cells do? The stem cells go, oh, I know what I'm going to be when I grow up. I was thinking, am I going to be skin? Am I going to be a kidney? Am I going to be a brain? What am I going to be? I'm going to become spinal tissue. They don't just say they have a treatment for spina bifida. The trial is actually called the CURE trial because they actually think they have a cure for spina bifida in the womb. So they will take these stem cells, and that's Dr. Diana Farmer, who works over at UC Davis, who's leading this research. And they'll take the stem cells, they'll put them on a little patch, they apply that directly to the baby's spine, and these spinal tissue cells start to develop normally, and they deliver these babies, and they're having amazing outcomes. So now we're on our third generation of spina bifida corrective surgery. So a patient is a person, no matter how small. And you think, oh, it can't get cooler than that. Oh, it's getting cooler, y'all. Let me show you. When it comes to spina bifida, that is absolutely amazing. But now we're doing open heart surgery on these babies on the inside. Cleveland Clinic recently, about 2 years ago, they had a baby that was diagnosed with something called a teratoma, a tumor in the heart. So we're in medical school. We're going to show you some ultrasound images, and we're going to test your anatomy knowledge. If this is a normal heart, right there in the middle of your chest, what's to the side of the heart? What's that right over here? What do you think that is? What's it? Lung. And if you got a lung over here, what do you got over on this side? The other lung. What's this right here in front of the heart? That's not supposed to be there. You know, especially when we put a big magnifying glass around it, that's not supposed to be there. So that is the teratoma. That is the tumor. The tumor was growing so quickly that it was actually interfering with the pumping and development of the baby's heart. So the doctors over at the Cleveland Clinic gave the parents some options. They said, look, this tumor, if it continues to grow, is going to kill your baby. Option number one, we can deliver your baby at 27 weeks gestation, do the open heart surgery, and send the baby to the NICU. But now we have a 27-week preemie that just had open heart surgery that has to now fend for itself in the NICU. They're like, all right, not really loving option number one. What else you got? And they said, we think we have the technology, and we think we have the skills, and we have discussed this. We'd like to operate on your baby while your baby is still in the womb, remove the tumor, close the womb, and let the baby develop afterwards. And that's what they did. So they said, okay, let's do that and let's get involved. What you're going to see is the animation. I'll explain it to you a little bit ahead of time. The baby's on the inside. Mom got an epidural, just like if she's getting a C-section. So mom got an epidural, so she's wide awake saying, okay, guys, we're having surgery today. Everybody got a good night's sleep? Your flights were on time and all that stuff? Yeah. And so she's wide awake, but she's comfortable. They made an incision in her belly, made an incision in the womb. They brought the baby's left hand, they brought the baby's right hand. Why? Just because they wanted to see the chest? No, they actually had a pediatric anesthesiologist that started an IV in the baby's hand. The baby's not just getting fluid, the baby is getting fentanyl for pain, and the baby is getting Norcuron, a paralytic, so the baby's not moving around while they're doing open heart surgery. Then they brought in the cardiothoracic team. They actually did the open heart surgery. This is how the animation worked. And I'll kind of narrate this as we go. This is the mom. Baby is 27 weeks along. There's the baby's heart. You can see the baby's heart is beating. But it's like, well, what's that? That's the teratoma. We're going to zoom in a little bit. Right there, that golf ball shaped thing, that's the teratoma on the baby's heart that was compressing on it. Mom's comfortable with an epidural. They made an incision right there in the mom's skin. Then they worked away and they made an incision in the uterus itself, like a little mini C-section, brought out the right hand, brought out the left hand, cued the pediatric anesthesiologist who says, my turn. He starts an IV on the baby. The baby's getting anesthesia. The baby's comfortable. Then they say, cue the cardiothoracic team, make an incision in the baby's chest, remove the tumor from the baby's chest. Almost immediately, the baby's heart starts pumping normally and says, thank you. Then they close the baby's chest. They remove the IV. They tuck the hands back in. They then close the uterus and they close the skin, and they deliver that baby 10 weeks later at 37 weeks gestation. So if we can do open heart surgery and have 2 anesthesiologists on a baby on the inside. Is that our patient? Absolutely. When I do a hysterectomy on a patient, do I say, well, we're going to get you an anesthesiologist and a separate anesthesiologist to make sure your uterus is comfortable? No. Why? Because the uterus is part of the mom. The baby is not part of the mom. The mom is the nutritional support system, and she is the support system for the baby, but this baby has a totally different nervous system, neurovascular system. So if we can treat that baby as that a patient, this is healthcare. This is that team over at the hospital that is actually performing open heart surgery. I mean, you had over 30 doctors, nurses, and techs, different teams, anesthesia teams, cardiothoracic teams, all working. You had a mom with a heartbeat and a baby with a heartbeat that walked into that room, and what did you have walk out? A mom with a heartbeat and a baby with a heartbeat. What's abortion? You have a mom with a heartbeat and a baby with a heartbeat that walk into the room. 20 minutes later, you only have a mom with a heartbeat that leaves the room. That is not health care. This is health care. This is health care at the highest level, where we have 2 patients and save both of their lives. We talked about the IV. That is that baby with the IV in that baby's hand. You've all had IVs before. You know those little teeny tiny things? Well, when your hand's only this big, it looks like a garden hose going on the inside. But that's the little hand that had the IV started by the anesthesiologist. It's like, well, how'd the kid do? That's how the kid did. That's Rylan. Rylan just turned 2 years of age. Is he a beautiful little boy, created in the image of God, and the patient there? Yes. And you know what? You can barely even see the scar. Why? Because he was still growing and developing. There's hardly any scar in Rylan's chest. A patient is a person, no matter how small. And if we can treat him in the womb as a patient, then as a patient, he has rights. And you're like, well, it can't get cooler than open heart surgery. You should see what they just did 5 weeks ago. 5 weeks ago, you know, some people say, well, you know, it's not like they're doing brain surgery, right? I mean, so if they were doing so like you weren't impressed with the laser vascular surgery, the blood transfusions, the open heart surgery, that didn't impress you. But if they were doing brain surgery, then you'd agree that the baby in the womb is a patient. Why, yes. Well, guess what? We're doing brain surgery on babies on the inside of the womb. There's a condition called a Galen malformation. Galen malformation, it's a defect in the vasculature of the baby's brain, where you have a high pressure artery that's connecting to a low pressure vein. And we saw the perfect example when we were in Colorado speaking last week. We went to the springs, and somebody was blowing up one of these big rafts for their kid to play on. And, you know, they're just with the big, you know, gas station type thing. All of a sudden, everybody, it sounded like a gunshot. All of a sudden, boom, they had blown it up. That's essentially what happens when you have a high pressure artery connecting with a low pressure vein. So this is what it looks like. It's called a Galen malformation. We're going to zoom in a little bit on this. But here's what's going on. You have a high pressure artery that's connecting with this low pressure vein, and the vein says, I can't take that much pressure, I just can't take it anymore, and it's just getting bigger and bigger, and it actually can put the babies into heart failure in addition to the damage it's doing to the brain. So how do you fix that? Well, we're going to show you. When it comes to repairing this, they're actually going to put some plugs in the connection between the high pressure artery and the low pressure vein. Here's the mom, baby's there on the inside. Baby's been diagnosed with this Galen malformation. Half these kids get really sick, and of those that get sick, half of them die right after delivery. Needle goes down, needle goes through the skin, through the wall of the uterus. Needle actually goes in through the back of the skull, and they actually will go into this connection between the two. And they're going to place some little coils that are just going to patch this up there on the inside. The needle goes right into the blood vessel, controlled by the ultrasound. Now they're going to place these coils. This is our connection. And it's like, we can't have this connection because we need to build a wall. Who said that? You know, so we're going to build a wall there with the coils. And they build the wall with the coils, and they have occluded that connection between the two. They then take the needle out, they deliver that baby, and that baby does great. In fact, Dr. Sanjay Gupta, who's with what broadcast? What is it? CNN? Is that it? That's the Christian News Network, right? Yeah. Conservative News Network, right? Catholic News Network, right? No, it's cable news network. And what do kids say? You know, what's a cable? I mean, they don't even know what it is. But it's a cable news network. Sanjay's a neurosurgeon, and he thought this was just cool as can be. And I want you to listen to Sanjay Gupta as he's describing the surgery on the inside of the womb. Make sure our volume's working here.
In utero surgery also means they had to take 2 patients to the operating room instead of 1.
Did you all catch that?
And they had to then...
Listen to what he says. I'm saying that patients have rights, and a patient is a person no matter how small.
In utero surgery also means they had to take 2 patients to the operating
They're
room
both
instead
patients.
of 1. And they
2
had to
patients
then
were
very
taken into the
carefully
operating room
catheter
instead of just
right in the
1.
middle of
And
that
there you can see them
gigantic
putting the
blood
little
vessel
coils in there.
inside.
I think my animation is a little bit better to describe, but that's baby Denver. Baby Denver was born a little bit after that. Baby Denver is doing well. So if we can actually now do vascular brain surgery on the baby while it is on the inside of the womb and save that baby's life, is that a patient? Absolutely, and Sanjay Gupta agrees with us. And a patient is a person, no matter how small. So these are just some of the examples. If we have twins, and I've delivered lots of set of twins, we have 2 patients. Triplets, we've got 4 patients. Quadruplets, we've got 5, and we've done quintuplets at my hospital. We've had, and quads, I've delivered quads. Quads are cool. You make the incision for like the C-section, and then you become a magician. You know, rabbit. Rabbit, rabbit. Meanwhile, the NICU's like, slow down, you know? But I mean, it's amazing you deliver these babies. And after you deliver the 4th, you always have to take that one more little check just to make sure the ultrasounds weren't wrong. But when we treat the preborn as patients, and you can even look at the way that the fetal surgery centers, it used to always be referred to as maternal fetal surgery. This is NYU. NYU, they're not exactly a conservative bastion of medicine. NYU refers to their program as a fetal diagnostic and treatment program. They are all across the country saying, we are the fetal diagnosis and treatment. They don't even talk about the mom anymore. They put the emphasis on the baby. And fetus doesn't mean they're not important. Fetus is just a Latin word that means little one. So fetus, like, well, it's just a fetus. No, it's a little one, created in the image of God at the moment of conception. Even ACOG, which is my governing body, says when it comes to informed consent, it's respect for the patient as a person. Clearly, we are treating the babies in the womb as patients, and a patient is a person, no matter how small. And as amazing as medicine is getting and the advances, I mean, there's new stuff coming out on fetal surgery. Nobody's done a robotic surgery on a baby in the womb, but give somebody a toy, somebody's going to want to do it. Robots are cool, you know, and somebody's going to do a robotic surgery. The things that we're doing now, we didn't even think were possible just a year ago, and we have a whole new field of medicine. But as amazing as medicine is, we still have a lot of problems. When it comes to death, narcotics, I don't know if y'all have a problem up here with narcotics. Yeah, Oregon has a problem, Washington State too? No, because we've got this stuff called fentanyl. It's just, you know, last year for the first time, over 109,000 people died just from drug overdoses. Most of them were narcotics, and the majority of them were because of fentanyl. And that is a lot of my patients that are dying from drug overdoses, and a lot of them, unfortunately, are pregnant. Now, everybody who takes too much of a narcotic, do they automatically die? No. Do we have an antidote? Sure, we have an antidote. It's called Narcan. Narcan's in a lot of churches. It's in a lot of schools. I mean, we keep it in our grocery stores in Florida. You know, somebody goes down, they won't wake up, give them a hit of Narcan. It's amazing. A lot of times they'll just wake up. There's even Narcan for the canine cops to give to their dogs when they sniff a narcotic out, and then the dog goes down, they give them a nasal spray of Narcan, wake it up and say, okay, now let's get back to work. You know, but 109,000 people, we give them Narcan. But there's another problem that's sweeping the United States, and that's the abortion pill. Karen touched on the abortion pill. For the first time, we have more babies that are being aborted with the abortion pill than with a surgical abortion. Over 54% of all the abortions in the United States are with the abortion pill. In a lot of states, it's available mail order. A lot of schools are now having it on their college campuses where it's available through the health center. But we're going to talk about the difference. We're going to educate. Is there a difference between the abortion pill and the morning after pill? Because the morning after pill is available in any drugstore. And the morning after pill is evil in its own way, but it is indicated for taking the morning after a woman has had intercourse. How's that different from the abortion pill? The abortion pill is not just indicated for the morning after. It is indicated for 70 mornings after. It is indicated for 10 weeks gestation. It is 98% effective in killing a baby with a heartbeat that's moving around on the inside, and that is the abortion pill. Well, how does it work? It works by blocking a real important hormone called progesterone. Big medical school term, progesterone. Get a big word, break it down to little pieces. Progestational steroid hormone. When a woman becomes pregnant, this is the coach. You've got your beavers over here. You got beavers and ducks around here playing football. Who's in charge of the team and the decisions? That's the coach. Progesterone is the coach of the game of pregnancy. Everything that's good about a pregnancy is because of progesterone. Progesterone gets up there and says, okay, woman's body, we're going to have to divert more nutrition to the uterus. Uterus, you're going to need to relax. We're going to have more oxygen, more blood. We're going to increase the appetite. We're going to get more nutrition for the mom, and we're going to grow a baby. Everything that's good is because of progesterone. How does the abortion pill work? The abortion pill will block that hormone called progesterone. So the woman's body's like, yay, we're pregnant. Then they take the abortion pill and the woman's body's like, man, I don't hear that coach anymore. Are we still pregnant even? If we're not pregnant, we probably don't need progesterone. Progesterone gets blocked, and that's what leads to the abortion. Do women have regrets when they take, you'll hear Planned Parenthood say, well, nobody regrets their abortion. Yes, they do regret their abortion. Anybody who's done any post-abortive counseling knows these moms are hurting. Is abortion wrong? Yes. But guess what? The blood of Jesus is able to cover that sin of abortion in the past. There are moms and there are dads. There was a recent survey that was released. Do you know that in the most conservative churches, 18% of the men and the women have personally been involved in an abortion, and in the other churches it was as high as 24%. So what did Paul say? We think, that's something really, really bad. Paul said, forget about what lies behind and press on towards what's ahead. That's why the message of the gospel and forgiveness is so important. These men and these women need healing. Well, how do we heal? We heal with forgiveness, and true forgiveness only comes through the blood of Jesus Christ. The abortion pill blocks this hormone called progesterone. That's how it works. You take this blocker. This is what happens at the moment of, this is ovulation. Ladies, you're so elegant when it comes to ovulating. You just sort of say, well, I'm going to have my hormone levels go up. I'm going to make a little cyst, and boop, and I'm going to ovulate an egg out. And there's that little egg that comes out. And the progesterone level's like, I hope we're going to get pregnant, hope we're going to get pregnant. But if you don't get pregnant, and the progesterone levels naturally go down, you have a menstrual cycle. That's how God designed it. Well, what happens if this egg happens to hook up with one of the 300 million sperm that guys send? Because we're not real elegant and detailed. We send out 300 little warriors. They all think they're Michael Phelps and they're swimming, swimming, swimming. They get to the top of the uterus. Do we ask for directions? No. 500 of them go, half them go left, half them go right. And then they finally get to the end and they're racing. They get to the one that they finally get to the egg. And it's like, oh, I hit the egg. I'm the winner. I'm Michael Phelps. I get the gold medal. Now, you got to get on the inside, dude. It's not just touching the outside. You got to get on the inside. So all this is going on the moment of conception. But if conception happens, great news. So the body says, we have a positive pregnancy test. We're going to let the progesterone level go up. Say the mom makes a mistake and she takes the abortion pill. What happens? The progesterone levels don't continue going up. The progesterone levels are blocked, and the progesterone levels are going down. And that is going to mean that we're no longer supporting that pregnancy. And the next day, the woman will take another medication called Cytotec, misoprostol, which causes contractions. And we use the same Cytotec in labor. If we have a patient, if I have a patient who's 40 weeks along, and she has an 8-pound baby, and I want to induce her, and her cervix is closed and thick, I give her the same medication called Cytotec. I give her 25 micrograms of Cytotec. If she's part of the abortion, pill protocol, does she get 25 micrograms to have her contract? No, she gets 800 micrograms to have her contract. That's why it's such intense pain and bleeding to push this baby out. So when the hormone levels of progesterone are going down, what is abortion pill reversal? It's real easy. We raise them back up again. And that's what I have done. I have performed abortion pill reversal. Attempted this now 19 times. We've been successful 15 times by doing something real simple, just by raising the progesterone levels. The progesterone is called micronized progesterone. It is made from soybeans and yams. It's bioidentical to what the woman's body makes. We use it in other areas of obstetrics all the time. We use it to prevent preterm labor. and triplets and quadruplets. We use it in vitro fertilization to prevent recurrent miscarriage. We use the exact same medication all the time in healthy, normal obstetrics. So yes, we can safely reverse. This is one of the first reversals I did in my practice. I mean, she made a bad choice, and do women have regrets? Yes. When did she have her regret? She was still in the parking lot of the abortion clinic in Mobile, Alabama when she had her regret. She called us from the parking lot, and she said, I made a mistake. We offered her the medicine, we gave her the medicine, we paid for the medicine, and then what happened a couple of months later? Let's see. Baby Journey was born. Baby Journey was born. This is Baby Journey, who just started kindergarten in Mobile, Alabama, 3 weeks ago. That's the same baby. So when you look at the lives that you're saving, you're looking at babies who are being adopted. Yes, we want them to have a heartbeat. We want them to continue. But this is Baby Journey. She wouldn't even be here on this earth unless we had gotten involved in that. This is one of our more recent reversals right here. This is, so cool. They were just dating, found out they were pregnant. She was scared to death. She took the abortion pill, and then she had profound regrets. Called us while she's on her way home. We were able to reverse it. And not only were we able to reverse it and see a heartbeat, she was my patient. So we actually got to deliver that baby. And the coolest thing is, what's my name? Yeah, William. What'd they name the kid? William. I mean, does it get cooler than that, I mean, what does William mean? Any other Williams in the room? Bills? Got a William in the back. It means the bold protector. So that's kind of like, yeah, that kind of feels fitting right there. But that's baby William right there. So here's the question. Is it just, well, I'm pro-abortion? Well, I'm pro-life. Or is it a little bit deeper than that? Is it just a choice? Like you had your choice. Well, you had a lot of choices on desserts tonight, and I saw some of y'all getting more than one, and it's all right. You can just make up for it when we have the collection later on tonight. But is it a choice? Are we involved in the greatest spiritual battle in the last 100 years? Clearly, this is a spiritual battle. I'm going to give you a freebie. Pastors, I know we have a few pastors here. Sanctity of Human Life Sunday is coming up in January. I want you to just pick up your phones. It's fine. You can check the score if you want, but pick up your phone and just look at this and just take an image. We professionally produced a DVD. There's a 3-minute, a 7-minute, and an 11-minute video in both English, and we had a guy down in Mexico dub it into Spanish. So you hear this, you know what my voice sounds like. It's not really cool. And all of a sudden this guy comes in with this beautiful Spanish, like Ricardo Montalban, welcome to Fantasy Island or something. But he does a great job. But I'd really encourage you, if your church does not have something going on for Sanctity of Human Life Sunday, just say, hey, Pastor, I got a 4-minute, I got a 7-minute, I got an 11-minute video. I've got it in English and Spanish, and it's going to cover a lot of things. So that's a freebie for you all here for tonight. But when it comes to life, what does Scripture say? We are involved in a spiritual battle. If you're involved in a spiritual battle, we better be looking at Scripture, because Scripture is going to be our offensive weapon. When it talks about the shield and the breastplate and the helmet, what's our one offensive weapon? It's the sword, and that is the Word of God. So we need to engage with the Word of God. Genesis 1:26, and God said, let us make man in our image, after our likeness. This is after all the creation, the billions of stars, the billions of galaxies, and then earth, all the mountains, all the rivers, all the streams, all the birds, all the mammals, all the fish, were all created. And God said, we're not complete. Let's make man in our image. And that's all of us. And that is at that moment of conception. We're not creating the image of God on our birthday. We're creating the image of God on that moment of conception. But what is abortion? American flag. You're seeing recently the American flag's getting burned. You see recently that the Israeli flag is being burned. Well, why would somebody want to burn a flag? A flag represents the image of the country. If you hate the United States, you want to destroy the image of the United States, which is the American flag. If you hate the nation of Israel, you want to destroy the image of the nation of Israel, which is the Israeli flag. What is abortion? It's an attack on the image of God, and that is that baby in the womb. And that's why we have a duty to defend that image of God in the woman. Well, when are we creating the image of God? We already talked about conception. When you have one egg and you have a couple 100 million sperm, But when you look with the right frequency of light at that moment of conception, we talked about Michael Phelps getting there. Well, what happens? How do we keep the silver medalists from getting in? How do we get the bronze medalists from going in? There's actually, God created a shield, and that shield is called the zone of Pelusa. And when that shield goes up, when the gold medalist gets in, there's a depolarization of zinc ions and potassium ions. And when you look with the right frequency of light, these are mammalian cells. When you look with the right frequency of light, you can actually see a flash of light. So when you hear somebody arrogantly say, well, Dr. Lyle, we really don't know when life begins. You got a flash of light going on, buddy. What else do you think is going on there? This is the moment that we are created in the image of God. More scripture. Jeremiah 1:5. Jeremiah is kind of like, I don't know what to do. What does God say to Jeremiah? He says, Jeremiah, before I formed thee in the belly, I knew you. Before thou camest forth out of the womb, I sanctified you. I set you apart, and I ordained thee to be a prophet unto the nations. God knew all of us while we were inside the womb. God knew Jeremiah while he was inside the womb. God knows the preborn. Psalm 139. The psalmist is saying, God, I don't understand about cell differentiation, how one cell gets together with a second cell and becomes two, and then 4, 8, 16, 32, 64, and then one cell says, I don't want to be an identical copy of you. I'm going to start the entire cardiovascular system. Another cell says, well, cool, you're going to do all the heart stuff? I'm going to do all the brain stuff. And how do they know when they have all these millions of pages of DNA what they're going to be when they grow up? Because when you have that kind of a design, there was an amazing designer, and that is Almighty God. But the psalmist is saying, you knit me in my mother's womb. I praise you so wonderfully. You made me. Romans 5:8. Any sinners in the room? Hi. It's better than like the last place. I mean, not a hand, I mean, I'm like, yeah, you're kind of looking at the clouds up above and see what's going on. But yeah, Romans 5:8. But God showed his love for us in this. While we were still sinners, that's all of us. That's my wife and I. All of us, Christ died for us. That's amazing love. But when we look back at Psalm 51:5, surely I was sinful at birth. And the NIV translates, sinful from the time my mother conceived me. So if we were all sinners from the moment of conception and Jesus came, lived a perfect life, gave his life for us, was dead, not just merely dead, but really most sincerely dead on the inside, and then 3 days later conquered death, that's amazing love that God not only has for all of us, but also for the preborn in the womb. So when you engage in battle, do you get involved in a battle just because you want to? Or do you really want to win? I don't want to engage in sports if I can't win. I don't want to engage in a battle. So can we win? Absolutely. In fact, we are winning. In fact, let me talk to you about Florida. You like our governor? I got a cool governor. Yeah. Les and I, a few months ago, actually spoke to members of the House and the Senate in the state of Florida. That night, the House voted to enact the heartbeat bill. 2 weeks later, the Senate passed the heartbeat bill. Later that night, Governor Ron DeSantis signed that into law. We've had a legal challenge, but we're going to get this back on track, and then we're going to go after the abortion pill. 4 years ago, state of Florida, the gestational age cap was 24 weeks gestation. We had babies at my hospital surviving at 23 weeks, but then you could legally abort a baby at 24 weeks. So we've gone from 24 weeks to 15 weeks to heartbeat. Now we're going after the abortion pill. So are we having victories around the country? Yes, but we need to all get engaged because Oregon is not lost. We just need to engage, and the church needs to engage in this battle. So we are having victories around the country. And what are the tools? I mean, it's a spiritual battle, but other tools? Yeah. I mean, you learned some new tools tonight when it comes to healthcare, medicine, obstetrics, gynecology, science. Is that a tool? Yeah. Do you want a bunch of obstetricians leading a spiritual battle? Nah. What's even scarier? Have we had victories with the politicians? Yeah, I mean, with the House and with the Senate, with the governors. Do we want a bunch of politicians leading the charge on a spiritual battle? No, we sure do not. When you have a spiritual battle, we really need to use our most valuable spiritual tools, which is the gospel. This is a message and a battle that should be run and led by our pastors up here in our pulpits. And yeah, the OBs can get involved. Yes, the politicians can get involved. But it really needs to be the pastors of our church. Because how are we going to win this? Well, let's look at the gospel. First 4 books in the New Testament, what are they? Read them out with me. Matthew, Mark, Luke, and John. When you combine the power of the gospel that can change hearts, minds, and behavior. And what's the fifth book of the New Testament? Everybody's like Matthew, Mark, Luke, John, Acts. And it's not just Acts. It is the Acts of the apostles. It's not the hangout of the apostles. It's not the just going to chill out of the apostles. It's the Acts of the apostles. It's the action. When you combine the power of the gospel with action, that is when we have victory, and that's when we win. That's when we save the lives of God's preborn. That's when we bring healing to the moms and the dads. And real importantly, that's when we save this nation and we save this country. 2,000 years ago, what did we have? We had Jesus, we had the gospel, and we had 12 people. Did they change the world? Yeah. What do we have now? Still have Jesus, still have the gospel, but now we have millions of people. There is no reason why we can't be victorious in this greatest spiritual battle of our lives. You have here before you an opportunity to save the lives of God's preborn while sharing the message of the gospel. You might have been watching some of the news that's going on in Israel recently. I want to tell you a story about Bruna. Bruna was a 24-year-old. She never had a baby. She had just recently immigrated from her homeland of Brazil to Israel. She, her sister, and her mom wanted to make Israel their new homeland. She was one of the first people killed during the attack, from the Gaza Strip that came over. And so now her mom and her sister, one of the first things they have to do in Israel is they have to bury their daughter. So they didn't know many people. In Jewish tradition, if you don't know Jewish tradition, you need to have, for big ceremonies, weddings, funerals, bar mitzvahs, bat mitzvahs, you have to have something called a minyan. A minyan is 10 people that get together. If you want to have a funeral, you've got to get 10 people together. They didn't know 10 people. They've sent out a little message on social media saying, we're new to the nation of Israel. Our daughter was enrolled actually in the IDF. We're going to need to have a funeral for her. We're just looking for 8 other people that could meet us during that funeral so that we can have a funeral for our daughter here in the nation of Israel. Did they get the 10? Yeah. How many did they get? They got 10,000 people that showed up at her funeral. That's the kind of response that we need, to really have victory in the greatest spiritual battle. You look at the numbers of churches, you look at the different denominations, we can win this. And the other thing I look at with Israel, remember in Judges 3, 4, 5, and 6, the children of Israel did evil in the sight of the Lord. And what did he do? He delivered them into the hands of their enemies. He strengthened their enemies. They went into captivity for 10 years, 7 years at a time. Is taking the lives of 63 million babies here in the United States doing evil in the sight of the Lord? Yeah. Is there any reason why the United States is going to be protected any longer? No. When I look at Israel, we spoke at Israel, about 10 years ago. And one of the things that we learned at the Holocaust Museum, they have a separate area just for the kids, that were killed during the Holocaust. But then I started to do, abortion has been legal in Israel since 1977. The year that we were there, it was about 1.5 million babies had been aborted in the nation of Israel. They have about 40,000 abortions that are legal in Israel each year. The number of babies that were being memorialized in Bad Yashem was actually 1.5 million. The number of babies aborted in Israel is now 1.6 million. So they've now had more Jewish babies aborted in the borders of Israel than Jewish kids that died during the entire Holocaust. So is that doing evil in the sight of the Lord? Yeah. So it's a battle for the individual babies. It's a battle for the lives of the moms and the dads. But we have an amazing tool. We have your pregnancy center, which we need to support. So when we put out the call that they have some needs, it needs to be like the call of we need 8 people to come up, to form a minyan to have our funeral for our daughter. We need to look at our priorities. Someday we're all going to see Jesus. Unless Jesus comes, he can come tonight because that's cool. I don't want to have to get up real early for the flight. I'll just fly on wings of eagles, and skip on the American wings. But that would be wonderful. But someday we're going to meet Jesus. And we're going to see him face to face, eye to eye. And we're going to think about what did I do for kingdom service while I was here on earth. And I don't know, maybe we'll think about what did we do for my church? What did I do when I was offered the opportunity to teach a Sunday school class? might think about tonight. What did I do? Yes, we need to pray for this ministry, which is a valuable ministry, which is sharing the gospel. But what did I do as far as meeting the financial needs of this ministry? And when we look back at our lives, when we're eye to eye with Jesus, we're like, I am here for all eternity in the presence of my Lord. We need to just pray that Jesus would look at us, and we'd be thinking about our past and hear those magic words that say, well done, thou good and faithful servant. So God bless you all, and thank you for the support of this center, because you have a great one.
Well, I had to follow you last year as well, so thank you for that. Appreciate it. Thank you, everyone, once again for coming to this banquet. Let's again give a very big thanks to Dr. Lyle for coming again to share his words of encouragement with us. It's obviously so valuable to hear from someone who's making such a difference in helping people such as us understand the gift of life itself and how we can all learn to protect life. So thank you for that. My name is Colin Hesse. I'm, for those of you who don't know me, I'm the chair of the board of directors at Options. I join with our CEO, Karen Tamling, our wonderful selfless staff, and the rest of the board in welcoming all of you here today. Thank you so much for taking some time out of this fall, this homecoming night, for those of you in Albany, if you had trouble getting babysitters like my wife and I did, to hear more about the work that's being done at Options. The theme for the banquet this year is Celebrate the Wonder of Life. I hope you hear three elements in that theme. First, there's the celebration of life itself, the work that God has done from creation that covers everything that was and is to come. In all senses, there's no celebration of life without celebrating the creator of life, God the Father. Dr. Lyle talked through us of the work in Jeremiah. Paul also writes in Ephesians, for he chose us in him before the creation of the world to be holy and blameless in his sight. Truly, nothing that we talk about today, nothing that this organization does can truly work on celebrating life outside of the umbrella of worshiping and following our Creator. The second element of this theme is celebrating the work that has been done towards a culture of life. And obviously, again, you've heard some of this from Dr. Lyle this evening and from women in our communities who've been blessed with this gift of life, and that Options has been a part of that journey for them. As a board, we celebrate every meeting the work that our staff does during the year as we hear and read story after stories of changed and saved lives. We'll read stories of women bursting into tears or their face glowing when they see their child on an ultrasound. We read about women who refer to Options as a lifesaver in dealing with their unexpected pregnancy. We'll read stories of deep conversations and prayer with hurting and vulnerable individuals, and fundamentally, women who decide to trust God and lean towards life at the end of their journey at Options. God uses this ministry, God uses this dedicated staff, and we celebrate the wonder of what God's been doing at Options. The final element of our theme is understanding the work that still needs to be done so that the wonder of life is truly celebrated in our communities. Oregon, obviously, is not the strongest state in the country in terms of celebrating life. We still hear stories of women coming from out of state in order to have an abortion here. Pregnancy centers, in particular, are being hammered across the country, and certainly here in Oregon as well, with people believing deep-seated lies around what a place like Options does. This leads to very deep-seated cultural beliefs surrounding issues of life, whether it's about when life begins, who should control these decisions, who's manipulating whom, and generally errors of cynicism and mistrust towards a place like Options. Thus, there's still great work to be done in helping our communities understand the value and, again, truly celebrate the wonder of life. So this is where this event comes into play, as Options, as an organization, is able to both communicate our gratitude and thanks to all who continue to support the mission of Options and truly celebrate the wonder of life, while also continuing to ask for your ongoing support to help the message of life shine into our communities. So again, we start this as I do every year when I'm up here with a deep, heartfelt thanks to all who have supported us previously. We thank you so much for your time, your prayers, your giving, your likes on social media, for any way that you assist the mission of the organization on a regular basis. We thank you for that. Let me talk you through a specific call to action that would come to all to us who want life truly celebrated in our communities, and how you can continue to partner with Options both this evening and in the year ahead. What can that partnership look like? Well, it can look like regular prayer for the mission and staff at Options, covering this organization in prayer when there appears to be more and more criticism and attacks coming at pregnancy centers across the country. It can look like volunteering in several capacities, from working with us at a baby bottles fundraiser at your church, to some volunteer hours at the center, or volunteering with events like our diaper giveaway, to even volunteering or serving on our board of directors. We certainly need 2 to 3 more individuals on the board itself, so something to prayerfully consider or direct someone you know. And finally, this organization cannot function, cannot do ministry in any capacity, cannot celebrate life without your financial gifts. Every year, Karen and the board of directors carefully and prayerfully put together a budget. We put together a strategic plan, and all of that is based on these partnerships that we build with all of you throughout the year. Our goal for this evening is to raise $75,000 through one-time gifts or pledged monthly commitments for the year ahead. Last year, this money assisted us with expanding our mobile clinic service to Monmouth. It helped us support our hardworking existing staff. Other very large needs include things like a clinic director, someone to oversee those clinic tasks, such as ultrasounds and abortion reversal procedures. So let me be open and transparent. Right now, our yearly budget is just over $500,000. And so while Options does receive 1 or 2 small grants annually, the majority of assistance towards that number comes from people just like you. So any assistance from all of you towards that goal would obviously be tremendously helpful. Basically, your support allows us to assist every person who comes to the clinic at no cost to them. So for those of you in the room today, your table host has a form for you to complete. It has this wonderful little note in the middle of it. So host, would you please pass those forms out now?